Okay, we're going to start off with the biceps and the patellar deep tendon reflexes. To begin on the biceps, you start by putting a hand on the biceps tendon, and then you will strike the thumb with your instrument. You will feel and see the muscle contract. This is a very slight reflex. The next deep tendon reflex we will perform is the patellar reflex. For this, the legs will dangle over the table or chair. You find the patellar tendon with your thumb, and beneath it, you strike it. And look for the reflex. This is a more exaggerated reflex. Next, we will perform the pin dull temperature sensory system test. Using a safety pin or a slightly sharp object, tap different dermatomes of the patient's body and see if they can discern a sharp or dull sensation. The different dermatomes that should be tested include both shoulders, inner and outer forearms, thumbs and fingers, the front of the thighs, medial and lateral calves, and the toes. The next test is the Protonator Drift test of the motor system. Here you'll ask the patient to hold both arms forward, palms up, and close both eyes. Maintain this for 30 seconds.
2 hours later.
Swing the patient's arms briskly downward. The patient's arms should return smoothly to horizontal position. This requires muscular strength, position sense, and coordination. Next, we'll be performing the flexion and extension test of the motor system. Here, you will have the patient pull their forearm towards their shoulder. The examiner should grab the patient's wrist for resistance. Test both arms separately for strength. Next, extension will be tested by having the patient push their forearm towards the examiner while the arm is bent. Please document the presence or absence of any abnormal response and/or asymmetry between the left and right sides.